Monday, October 11th, 2021. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. We're going to take a look at a paper entitled Effects of Ozone Therapy on Cyclophosphamide-induced Urinary Bladder Toxicity in Rats. This comes to us from Turkey and is quite an interesting study. It was submitted in August of 2012 because it's really showing the antioxidant effect of ozone therapy, and specifically how ozone therapy affects glutathione, among other things. So let's take a look at what they found here in the study. I'm going to start by reading the first paragraph here. Cyclophosphamide, and we'll refer to it as CP hereafter, a cytotoxic alkylating agent, is used at high doses for the treatment of a number of cancers, including lymphoma, leukemia, bronchial, breast, and ovarian cancers, at low doses for the treatment of autoimmune diseases, and also as an immunosuppressant after organ transplantation. So that's what CP is in brief. As we scroll down and take a look at the study, alkylating enters rapidly into the uroepithelium because of its chemical nature, an unsaturated aldehyde, and causes increased reactive oxygen species, or ROSs, production in the bladder epithelium, which is the issue. Okay, so that's what we're dealing with, and as many people already know, ozone therapy does actually produce ROSs as well. So how could it help in this situation? It was demonstrated that ozone increased antioxidant enzyme activity such as glutathione peroxidase, superoxide dismutase, and catalase. So that's how. Because the ozone therapy, paradoxically, creates a little bit of oxidative stress that helps the body respond positively to these types of issues going on. So there was a sham group, there was an ozone therapy group, there was a CP group where they treated it just with a drug, there was an ozone therapy preconditioned and then CP, and then there was a CP group and ozone therapy treatments afterwards. So those were the various groups that were treated. And I'm going to scroll way down here. You can take a look at the histological structures in the pictures there. You can take a look at these charts which show the different protein levels and the glutathione levels of the various groups, sham group, all the way through the CP and ozone therapy group, which, again, ozone therapy was administered after the CP injection. So treatment with ozone therapy following CP injection was more effective than treatment with ozone therapy prior to CP injection. The CP plus ozone therapy group showed us only slight degeneration of the connective tissue related to the relative to the sham group or ozone therapy alone group. So you see, CP injections resulted in an increased MDA, MPO, NO levels, and decreased GSH levels, indicating, here's the key, that oxidative stress was present in the bladders. So that's the problem. Additionally, it's been shown that bladder damage may be due not only to the overproduction of NO, but also of reactive oxygen species, or ROSs. It is well known that reactions of ROS with biomolecules such as lipids can initiate chain reactions and lead to tissue damage. So that's what's going on. And in particular, decreased glutathione. So what did we see about ozone in all of this? Because, again, we're running out of time. Ozone, one of the most potent oxidizers, may induce an antioxidant response capable of reversing a chronic oxidative stress that may, at first sight, seem, of course, a paradoxical concept. In conclusion, the results of the present study demonstrate that NO and ROS may be responsible, at least in part, for CP-induced bladder damage. Furthermore, ozone therapy may ameliorate bladder damage by scavenging ROS and reducing NO levels. There you have it. This has been 5 Minutes of Proof. We'll look forward to seeing you next week with another installment.